Sulfonamide type loop diuretics, they end in the suffix IDE. So you have bumetanide, furosemide, which is Lasix, and torsemide, which is Demodex. So the action of these diuretics are to inhibit sodium and chloride reabsorption from the ascending limb of the loop of Henle. For furosemide, the max diuretic effect occurs 1 to 2 hours after oral administration and lasts 4 to 6 hours. Diuresis occurs 5 to 10 minutes after IV administration and it lasts 2 hours. For bumetanide, the diuretic activity starts 30 to 60 minutes orally, peaks within 1 to 2 hours, and lasts 4 to 6 hours. The IV is 15 to 30 minutes. For torsemide, the max effect occurs 1 to 2 hours after oral administration, and it lasts 6 to 8 hours. Diuresis occurs 5 to 10 minutes after IV administration. It peaks within 60 minutes and it lasts up to 6 hours. So one way to remember those times is the word Lasix. So 6 equals it lasts up to 6 hours. Uses. So they're used for edema, cirrhosis of the liver, renal disease, hypertension, and heart failure. We know these drugs are effective when the therapeutic outcome is reduction of edema, reduction of blood pressure, and improvement of excessive fluid accumulation. So for your nursing implications, you want to assess for oral irritation and dry mouth, and you want to increase oral hygiene. You can suggest 1 teaspoon of hydrogen peroxide and 6 to 8 ounces of water as a mouthwash. And you don't want to use the over-the-counter mouthwashes because they contain alcohol, so that can increase the dryness of the mouth. You can also offer ice chips or hard candy. Next, you want to assess for orthostatic hypotension. So monitor the blood pressure and teach the patient to rise slowly from lying to sitting position. Your major side effects are gastric irritation, so you can give it with food or milk, electrolyte imbalance and dehydration, so you want to monitor their INO. You have hyperuricemia, which is that uric acid, so you want to assess for a history of gout and you want to monitor for any new signs and symptoms of gout and report that. Also hyperglycemia, so for your diabetic patients, you want to make sure you're checking their blood pressure and their blood glucose. So drug interactions, digoxin. So patients who are also taking digoxin, you want to monitor for digitalis toxicity due to the excessive excretion of potassium. Those who are taking aminoglycosides, which are your antibiotics, you want to monitor for any ototoxicity. So that is the ringing in the ear, the tinnitus. Also with the cisplatin, you want to monitor ototoxicity. Patients taking NSAIDs such as Motrin, Advil, they inhibit diuretic activity. So the patient may need an increased dose of your diuretic. Corticosteroids, they may enhance the loss of potassium. And metazolam increases diuresis, so you want to monitor for dehydration and electrolyte imbalance. So that is your loop diuretics. Remember, they end in "ide." You have bumetanide, furosemide, and torsemide. You can remember that they have a lasting effect of up to 6 hours by remembering the word Lasix, and that 6 lasts up to 6 hours. It's used for mainly edema and lowering hypertension, and you want to remember to increase their oral hygiene, assess for orthostatic hypotension, and monitor for those side effects. So that is loop diuretics.